So the National Organization for Public Health Nursing uh, started to form around 1914, 1920s, so 30s. Mainly hired, many newly hired public health nurses had to verify completion of a certification. The American Public Health Association in 1872 sought their interprofessional teamwork and promoted practical application of public hygiene. So in the late 1800s, local health departments formed. The federal role in public health gradually expanded. So in 1912, we had the U.S. Public Health Service role defined. The National Organization for Public Health Nursing was loaned a nurse to the U.S. PHS. And World War I depleted the ranks of public health nurses because we needed them. Shortly after World War I was a worldwide influenza pandemic known as the Spanish influenza. For those of you who've seen like Downton Abbey or what was that movie? Twilight. That's how Edward Cullen died, was during the Spanish influenza. But it really sprung on the desire to have more population health and to look at the prevention of communicable disease. And Johns Hopkins University actually just really started to become what it was after this Spanish influenza, and it killed so many people. There's this amazing book called The Great Influenza, and I would recommend, if you're interested in epidemiology, to read it. It's a great book. So paying the bills for public health nursing, the Metropolitan Life Insurance Company came into play, the Shepard-Towner Act, and also there was individual commitment and private financial support. The Frontier Nursing Service, which we still see today in the form of the school Frontier Nursing College. It's now mainly online, but it is a wonderful nursing program. They have lots of amazing, rigorous programs. And it's a really cool so the Shepard-Towner Act is also known as the Promotion of Welfare and Hygiene of Maternity and Infancy Act, and this was put in 1921. So it was an act of Congress, and it provided federal funding for maternity and child care. We had this huge infant mortality rate in the United States, and President Harding in 1921, this was his first major legislation. And, you know, what happened in 1920, women got the right to vote, and concerns were being discussed about hygiene for women. So there was a lack of adequate medical care for women and children. 80% of all expectant moms at that time didn't have any type of advice or trained care. Babies were being born at home, which, you know, in other countries, it kind of worked out because they had district nurses going for prenatal care and birthing babies, but we didn't have that here. So we had really high rates of infant and maternal mortality. And there was a mass autopsy. I think like 23,000 children were examined, and they concluded that the U.S. infant mortality rate was 111 deaths per 1,000 live births, which is crazy. And at the time, it was higher than most other industrialized countries. We still actually have quite a high infant mortality rate comparable to the whole world. And the problems were usually preventable, like lack of infant care knowledge. A lot of rural women didn't have access to medical care. There was a lot of post-birth cord cutting issues. There was a lot of poverty issues. And so they passed this act to help fund prenatal care and maternity care. And part of it was just based on hygiene, you know, like don't put the baby by the fireplace. So it was a really interesting act. You can read more about it. So in 1919, the National Health Circle for Colored People by Bessie M. Haas. She's an amazing, amazing African-American nurse. So in 1919, there was something called the National Health Circle for Colored People, and it was established to promote public health work in African American communities by giving scholarships to assist African American nurses to go to nursing school and learn about public health. So Bessie M. Hawes was the first recipient of the scholarship. She went to Columbia University in New York, and then she was sent to the Circle to Petalka, Florida. So this was a really small rural town, and it was isolated. And her first project was to recruit school-age girls to promote health by dressing as nurses and marching in a parade to sing songs. She conducted these huge meetings. She had mothers clubs. She gave school education, visited homes in the sick. She eventually became a leader in the community, and she built health centers for nursing care and treatment. And actually, she had a lot of pushback from the community and also from white people. They didn't want her doing what she was doing. And she helped break down a lot of barriers and improve health among the rural African American community. So nursing education was actually segregated until 1960. So between World War I and World War II, we had a huge economic depression. So the agencies and communities weren't prepared to address the needs. There were so many people impoverished, so much abuse. And then, of course, there was no access to health care and there was no funding. So agencies that supported nurse employment are here below. And only 7% of nurses working in public health were actually adequately prepared. In 1935, FDR implemented the Social Security Act, and it funded opportunities for education and employment of public health nurses. It funded assistance to states, counties, and medical districts to give adequate health service, and it provided funds for research and investigation of disease. So with World War II, there was extension and retrenchment in public health nursing. There was a huge need for nurses. Obviously, World War II, they needed people to go to war. And really, women went and many died in the front lines. But we had the Nursing Council on National Defense, the Army and Navy Nurse Corps, which you can still join to this day, the Bolton Act of 1943, which implemented Cadet Nursing Corps, and there was this huge expansion of public health scope of practice for emergency, maternity, and infant care. And there was lots of job opportunities for nurses. So as the national crude mortality rate dropped 47%, there was a huge change of leading cause of death. It was no longer acute issues. It was communicable. It went from communicable diseases to chronic diseases. So you no longer died of the flu, because, we had vaccinations. You no longer died of polio because we vaccinated against it. You no longer died of measles because we vaccinated against it. And so people were getting older. We had the baby boomers, and chronic disease took over as the leading cause of death. So we need more home care programs. And it became reimbursable by health insurances, Medicare and Medicaid. So which was the leading cause of the rise in chronic illness deaths? National crude mortality rate, growth of an aging population, rise in communicable diseases, or decrease in in-home nursing services. So it was B, growth of an aging population. So hospitals were preferred for illness and childbirth, so funding stopped for visiting nursing services, which is terrible, right? Because it's the same as, midwifery. You could give birth at home safely for 99% of the population, and a lot of care could have been provided in the home. And here's a little more about different professional nursing education. But now I would actually like to move on to the next chapter.